In the fifth and final section of the lecture, now we will talk about the sarcomas and secondary tumors. In this, we will specifically talk about the rhabdomyosarcoma, some other sarcomas beside rhabdomyosarcomas, and also some secondary tumors of the middle ear and mastoid. The sarcomas, the rhabdomyosarcoma, if you see in this picture, rhabdo is for the skeletal and then myo is for muscle. So skeletal muscle sarcoma is rhabdomyosarcoma. Rare tumor, it mostly affects the children, so it's not very common in adults. Children are mostly affected by rhabdomyosarcoma. We already talked about the carcinoma of the mastoid and middle ear, and then we also talked about the benign tumor, glomus tumor of the middle ear and mastoid. So in the primary tumors of the middle ear and mastoid, we divided into benign and malignant. Benign was the glomus tumor, malignant was the carcinoma and sarcoma. So we already talked about the carcinomas, now the sarcomas, which also comes under the malignant tumor of the mastoid and the middle ear cavity. Malignant tumors, they have the more invasive characteristic. They can spread to distant areas fast as compared to benign, which are less invasive, more localized tumor. So as a result of their metastatic nature, they can spread to distant areas and spread widely, and by the time they are diagnosed, they are already invasive and spread to the different parts of the body. So sarcomas is, besides the carcinoma, another type of the malignant tumor of the mastoid and middle ear. So rare tumor, not very common, and it affects the children mostly, not the adults. The other two tumors, we said, the glomus and the carcinomas, they affect the females of the middle age, 40 to 50 or 60, and the difference now from sarcomas, they are mainly present in the children, not adults. So rare tumor, mostly affecting children, arises from the embryonic muscle tissue or the pluripotential mesenchyme. So it's arise from the embryonic tissue. That's why it's more common in the children, because of the origin from the embryonic tissue or pluripotential mesenchyme. Other sarcomas beside rhabdomyosarcoma, the other sarcomas which can be present, we have osteosarcomas, rhabdomyosarcoma from the skeletal muscle. Osteosarcoma is from the osteo is for bone, sarcoma arises from the bone. Lymphomas from the lymphatic tissues, lymphatic tissues. Then we have fibrosarcomas from the fibrous tissue, and chondro is for the cartilage. Chondrosarcomas are also rare. So sarcomas of the middle ear and mastoid are not very common. They are rare tumors, more common in children, develop from the embryonic tissue and from pluripotent cells. Now the secondary tumors. Secondary tumors are the tumors that spread from the other sites to the mastoid and middle ear. So origin is from the other areas. Secondary tumors, they can spread from the kidneys, they can spread from the bronchus, from the different parts of the body. So secondary tumors. Tumors of external auditory meatus, parotid gland, or nasopharynx. So secondary tumors, they are tumors of external. You can see it's a bad condition of this child. Secondary tumor, it affects the auditory meatus, parotid gland, or nasopharynx. Invade middle ear cleft either through the preformed pathway or bone erosion. So secondary tumors spread from the other area. They are not primary from the middle ear or mastoid, and they can spread to external auditory meatus, parotid gland, or nasopharynx. And once they spread, they can erode or they can invade the middle ear cleft. Either there is preformed path or it can cause erosion of the bone, and with the erosion of the bone, mastoid, petrous bone, different bones, temporal bone, it can spread to the middle ear cleft. So that was all about the lecture, tumors of the mastoid and middle ear, in which we talked in detail about the primary and secondary tumors that can affect middle ear and mastoid. Thank you for watching sqadia.com.